care. We should be aware that our nursing care system is changing. With this new health care, I'm sure there are going to be dramatically more changes in our care. The care that are giving to our families is very important. And you should not be afraid to think that you cannot take care of your family members. Now, name tags, positions, and titles do not mean that those people in the facilities is more able to take care of your family members than you are. There is training for taking care of your family members. We must realize that in our healthcare facilities, things are changing because of all the paperwork and all of the computers. They are doing more work toward computers and paperwork than they are hands-on for the care of our family members. Computers and paperwork with the new healthcare center system is going to get even worse than it is now. Now, if you have or have not had any relationships with the care facilities, I'm sure that you will. When you go into our facilities and take your family members, you will note that it takes such a long time. You maybe wait 30 minutes, 1 hour, or even longer before you see the face of anyone that will be taking care of your family members or that is already taking care of your family members. So a question what we must ask ourselves, who is the one that's going to be in the place to ask the questions and to answer all the questions? Kluger, Williams, and Wilkins, they talk about therapeutic communication, which is the act of giving, getting information, and interpreting the information. And you are more qualified to do that than the facility persons are, because you know your family members. And also, we must think about the health care, longer-term health care, the way that health care is changing now, the way that our families need to be taken care of. And when we think about that, we should think about the different things that will make a difference in the care. Such thing as verbal and nonverbal cues. The way a person moves, the frown on their face says a whole lot more than the medical things would say for you. And so you can look at your family member and really tell what's going on. Things such as eye contact and skeletal movements can help diagnose a patient and also can help determine the amount of pain that they're in. And what else we should remember is that there is more therapeutic care. And that care can be given by you. And that care is talked about by Podnik, which is one of the people that helped wrote the A&P of Edition 4. And so we need to realize that we can take care of our people. We also need to realize that we have to collect data. And we collect this data by communicating with the family members. And in collecting this data, we can help the doctors be more able to diagnose the problem. And another way that we can be more with our care for our family members is that pay close attention to what the doctors say. Pay attention to the diagnosis that the doctors diagnose your family member with. And then after you do that, be aware of the care people that come in to take care of them to make sure that they are carrying out what the doctor has prescribed. And if they are not, be able to report those things. And one of the ways to learn how to be a good care manager is to be able to study your medical books. Read all the literature and pamphlets that you can find. Go to your computer and look up on different things like Wikipedia. It'll give you information about patient care. And one of the other things that you can do is just to pay close attention. Be observant. Be well aware of what's really going on. Get involved. Observe your relatives for changes. Report them. What you should do is ask, make eye contact, and get direct answers. Don't go for vague answers. When you're given a vague answer, stop them and ask them what's really going on so that you will be able to ensure good patient care. most of all, get involved. Be active in your family personal care.